How far from the bulkhead should food service equipment be afloat? 8 inches ashore. 6 inches. How about supply of forms ashore? 3 months afloat. 6 months. Remember, the OD has to sample each meal. Who is held accountable for foodborne illness resulting from improper food preparation, serving, and storing? The food service officer. Food service workers will receive how much initial training? 6 hours initial. How much refresher? 6 hours refresher unless they're temporary, and if they're temporary, they're less than 30 days, and they would get 3 hours of food service training. A compartment for manually washing dishes. Remember, the water should be 125, the hottest temperature the hands can stand. The final rinse is 170. And the final rinse in a dishwashing machine is 180 to 195. The 2 GI cans in the field for boiling water is 212. Remember, there's 5 cans in the field. What temperature do fats and grease begin to break down? 120. Foods begin to bake on dishes at 140. Why are enameled utensils or containers prohibited in food service facilities? Because of antimony poisoning. Silver-plated utensils cause copper poisoning. And what type of poisoning can result when acid food or drink prepared in galvanized containers? Zinc poisoning. Leftovers should be kept how long? 36 hours. Leftovers, when they're to be reused, should be placed in a shallow container with a depth no greater than 3 inches. What distance should be allowed between the tops of stacks of meat and the open air ducts in a refrigerator? 6 inches. Milk on delivery temperature. 40 degrees on delivery. In the mess hall. 32 to 40 degrees. And what is the ideal temperature for the storage of eggs? 32. Fresh eggs are not over 30 days old. Freshly processed eggs have been preserved by dipping in a warm mineral solution at what temperature? 100 to 110. Remember, the sign that a fish has been refrozen is soft, flabby skin. Wrapping paper may become moist, slimy, or discolored. The bottom of the box is distorted, or they may have ice in the bottom of the box. Remember that a fresh fish is firm, elastic to touch. It has bright red gills. What official must inspect all meat products, poultry products intended for interstate shipment? The USDA, which is the United States Department of Agriculture. How about fish, shellfish? USDC, United States Department of Commerce. Remember that the stamping of the meat indicates the condition of the meat at the time of packing. And if you store meat at slightly higher temperature than those recommended, it has what effect on the meat? It cuts the storage life of the meat in half. If they ask you a question about what temperature should ice cream be kept at, it is 0 or lower. Any frozen food is 0 or lower. Dairy products box is 32 to 34. Chill box is 33 to 36. Thaw box is 36 to 38. Reach in reefer 34 to 40 degrees. How about bodies? 2.2 to 4.4 centigrade, which is 36 to 40 degrees Fahrenheit. What are semi-perishable food? Canned, dried, or dehydrated. What temperature should galley spaces be maintained at? 80. Living spaces. 70. Medical spaces. 70. Meat cutting preparation room. 50. If you receive green leafy vegetables of an unknown origin, it's got to be superchlorinated at 100 parts per million for 15 minutes, or 50 parts per million for 30 minutes. When you think 100 parts per million, you also think of what? Hoses for drinking water should be subjected to a chlorine solution at 100 parts per million, and you would run it through for how long? 30 seconds to 1 minute. When you think 30 seconds to 1 minute, you also think of what? Saffron in the gram stain is 30 seconds to 1 minute. Refrigerators should be defrosted when the frost reaches. Wrong answer. It's changed 1/4. 1/4 inch. Know that the relative humidity in the reefer should be maintained at 85 to 90%. And if you store fruits and vegetables in the same compartment and the temperature gets over 40 degrees, what might it cause? Carbon dioxide poisoning. Remember that if you store eggs and butter in the same compartment with fruits and vegetables, it may cause the eggs and butter to taste funny. Remember your temperature log. Outside the reefer, the temperature should be checked how many times a day? Twice a day, the same as your reefer that contains biologicals. And remember, it must be within a plus or minus 3 degrees to the recommended temperature. Dishwasher machine should be checked by maintenance personnel how often? Every month. If you prepare food and it's going to be longer than 4 hours before it's served, it's got to be kept below 40 or above 140. Remember, the temperature range that's ideal for the growth of bacteria is between 40 and 140. What type of organism is not destroyed by normal cooking? Staphylococcus aureus is not destroyed by normal cooking. If you have dry goods and you have insects, it must be surveyed if you have more than how many insects per pound? 7. If you have 6 or less, then you would freeze it for 72 hours, sift out the dead bugs, and have a party. How often should bacteriological testing be conducted on ice machines? Every week, the same as your bacteriological analysis of water. Remember that you would check 1/4 of all the ice machines at the unit. When you do a bacteriological analysis of water, that's called what test? The membrane filter technique. And a greenish gold metallic sheen indicates E. coli, coliform bacteria, or fecal contamination. What's the name of the test that's used to determine chlorine residual water? The Palin DPD. How often should ice making machines be checked for cockroach infestation? Every week. How many classes of sandwiches? 3. How many classes of frozen sandwiches? 2. Remember that the class of sandwich that's prepared in the list of dining facilities intended for use in flight or boat meals is class 2. 3 is produced in a commercial frozen food operation, which the central kitchen is designed specifically for mass sandwich production. Those are the 2 types of frozen sandwich, and 1 is dispensed over the counter in mobile food service trucks and vending machines. Remember what I said about hot sandwiches. If it's placed in a hot sandwich machine, it's not safe to eat for 2 hours or 120 minutes. How long can a frozen sandwich remain in the freezer? 60 days. Once a frozen sandwich is taken out of the refrigerator, it must be consumed within 5 hours. I don't know how the question might be worded, but they could have something on there about which one would you or would not go bad the quickest. Remember that if a sandwich has got mustard on it, that's a hell of a lot better than mayonnaise if you're going to keep it any length of time. What's the food service sanitation inspection report? Not lately. Food service sanitation inspection report, not food service training certificate. 6240/1. Remember that the sanitation inspection should be conducted how often? Every 2 weeks or bi-monthly. What's a correspondence manual? SecNav instruction 5216.5 Charles. Point 5 indicates the fifth instruction issued by SecNav on correspondence. Charlie indicates the third major revision of the fifth instruction issued by SecNav on correspondence. You can recommend changes to the correspondence manual if you write to who? The Naval Data Automation Command. The 4 international quarantinable diseases must be reported to who? The 4 international quarantinable diseases must be submitted to who? The World Health Organization. Remember that all outgoing correspondence will have letterhead. And the first part of the letterhead that is typed, printed, or rubber stamped, how many lines from the top? 4 lines. And what's the first part? Department of the Navy, and then the unit address. Navy letters have what size margins? 1-inch margins. Page numbering, a 1/2 inch from the bottom, starting with the number 2. Remember that the first page of a Navy letter is not numbered unless it's designated as top secret. Remember that every Navy letter that is classified will have a serial number. Remember the 3 identifying symbols in the upper right. The date indicated by the day, the month, the first 3 letters in the year. The SSIC, one of the 14 major subject classification groups, and the originator's code. Remember that the date is indicated the same way in the health record as it is in the upper part of the letter. But remember, if you use the date in the body of the letter, the month has to be spelled out. The same way with references and enclosures. When you use it on the left side, it's REF colon or ENCL colon, but in the body of the letter, it must be spelled out. When's the letter dated? The day that it's signed. Subject, remember the subject must be all caps with a max of how many words? 10. How many lines below the last line of the text is a signature? 4 lines. How many lines below the signature is a copy? 2. 2 lines. What is the minimum number of lines to have a second page? Not lately. 2. What are you laughing about? Don't you be talking now. You're getting that confused. How many lines below the top is the subject repeated on every page? That's 6. If you got to have the second page, you got to have a minimum of 2 lines of text. You got that now? Why don't you go ahead and turn face the camera? What type of correspondence is used for formal communication with activities within the Department of Defense, also used for activities outside the DoD if they've adapted the format? The Navy letter. And if you're writing to somebody on the outside and they're not familiar with the Navy letter, you would use a business letter, and a good complimentary close is sincerely. And if you're writing to somebody you don't know whether it's a man or a woman, you would address them as Mr. I know the women are trying to get that changed. What is used to approve, disapprove, forward, or comment on the contents of a letter which is transmitted through one or more addressees before it reaches its final destination? That is an endorsement. Remember that a speed letter is used for unclassified correspondence that don't require electrical transmission. What type of type is preferred in the Navy letter? Pica type is preferred over the smaller elite. A lot of people in the command have bidirection authority, but if they sign something bidirection and it affects pay and allowances, how's it signed? By direction of the commanding officer. If the CO is on leave and the XO is taken over for him, he would sign correspondence as acting. Congressional correspondence has to be acknowledged within 5 working days. An interim reply is required every 10 working days. What type of letter is used to address two or more activities that are individually identified or addressed as a group? That is a multiple address letter. Remember, a joint letter is used when officials of two or more activities issue a letter concerning a particular subject or administrative problem common to both activities. What's the most formal memorandum? Memorandum 4. What's the most informal? Printed memorandum form. How many pen and ink changes can you make to a Navy letter? 2 per page. Ha. What color and type of paper is used for command file copies? Yellow tissue or photocopy. Don't say white, photo. What type of envelopes are preferred for Navy letters? Window envelope. What's the instruction on immunizations? 6230.3. Remember that immunizations, if you get an exemption, it can only be given for medical reasons. It's given by a surgeon, staff medical officer, or the commanding officer of medical treatment facilities. Waivers are given for administrative reasons and can only be given by the SG or the Commandant of the Marine Corps. And waivers are normally only given for religious objections to shots. And if somebody has a religious objection to getting a shot, then they are boarded out of the Navy. But know that a permanent exemption may not be given for yellow fever or cholera. People come on active duty, they have to have their shots up to date if they're going to be on active duty for more than 30 days. Remember that manufacturers of biologicals must be licensed by who? The Secretary of the Treasury. Immunizations. If you have a vial of an immunization, it has an expiration date on it, and it may not be used beyond the stated expiration date unless you have approval of the Surgeon General. What biologicals must be kept frozen for preservation? Yellow fever and oral polio. What's the handling code? W. Must be frozen for preservation. What is subject to damage by freezing? F. What is inflammable? I. What is normal refrigeration? G. And what is the temperature in the reefer? Not 0 or below. That's for frozen. 35.6 to 46.4 is your normal temperature in the icebox. Remember, yellow fever and your oral polio must be kept frozen for preservation. If you thaw out a container of oral polio and you give out a dose and you put it back in the refrigerator, it is good for 7 days. If you reconstitute yellow fever with sodium chloride, it is good for, thank you, Phil, 1 hour. If a person needs a yellow fever shot, they haven't had the yellow fever shot within the last 10 years, and they're going to an area that is endemic to yellow fever, they have to get it how many days before they arrive in that country? 12 days. What immunization requires a booster be given? Every 10 years in addition to yellow fever. Tetanus. But if a person had a burn or an injury and they haven't had the tetanus within the last 5 years, they have to get a booster. What immunization requires a booster be given every 6 months? Cholera and plague every 6 months. If you're in an area that is endemic to cholera or plague. Biological shipments which show a change in physical appearance or suggest bacterial contamination will not be used. Disposition instructions should be requested from the supply source. People that have significant allergies to eggs or fowl should never receive. Timmy, T is. Typhus, I is. Influenza, M is. Measles, and Y is. Yellow fever. What are the 4 international quarantainable diseases? Psych, P is plague, Y is yellow fever, S is smallpox, and C is cholera. Immunizations on the PHS 731, a yellow shot card that must be authenticated by the actual signature of the doctor, are for all of them except plague. If you have an empty container of a live virus, what is the proper way of disposing of it? Either burn it, boil it, or autoclave it. If a person is bitten by an animal, you must start rabies vaccine if they are bitten in what region? In the face. What's the most common injury seen by a corpsman? Soft tissue injury. Remember, before you give any immunizing agent, you should have a syringe loaded with a half cc epinephrine and a constricting band. And if a person has an anaphylactic reaction, then the first sign is what? Urticaria, which is hives. You would give a half cc epinephrine in any available site. You wouldn't stop to prepare the site of injection. You'd get the epinephrine in them. Once the doctor got there, if he still had problems, he would give an additional half cc in the femoral vein. And after several minutes, if he still had problems, he would have given an additional half cc directly into the heart. Air crew members will not fly for a minimum of 12 hours after they receive a injection. But preferably, if it's not detrimental to the mission, it should be 24 hours. So watch how the question might be worded. When would a person get their first typhoid shot? Yes?
What is the book that says that flight crew members, with the exception of smallpox or polio, can't fly 12 hours, a minimum of 24, but with the exception of polio?
What I just say? Any injection. You could, really, if you really get technical about it, you could consider oral polio as an injection because it's going into the skin. But I say that. But they're not going to get that nitpicky on it. If they ask you something on it's going to ask you about, they should be grounded for a minimum of 12 hours or preferably 24 hours. What immunization must only be given IM? Plague. Remember, a lot of shots are given either sub-Q or IM, but plague has to be given IM. And remember that you would never give typhoid intradermally. Typhoid would be given at the person's first permanent duty station. You should never give typhoid to somebody who just completed any type of strenuous physical activity or if it's extremely hot in the area. If somebody starts a basic series of a shot, there's 3 shots in the series, they get the first one, something happens, they don't get the next in their dose, and 3 years later you find it in the record, what are you going to do? Continue them on. You wouldn't start them over again. If a single category is completely filled on the standard form 601, you would make another 601 out and keep the old one in the record. What's the minimum time between the doses of live viruses? Okay, now that's a change too. But chances are the change is so new that the new change won't be on there. The new one's 14. Remember, the hypersensitivity entries in the health record should go on the outside of the health record jacket. In the block it's indicated, should go on the NABMED 6150/20, which is a problem summary record. Also should go on the standard form 601, the immunization record, on the back in remarks and recommendations. A person goes to boot camp, they get their first smallpox vaccination. How's it recorded? If it takes, it's recorded as successful. If it doesn't take, it's repeated every 10 days until the person has a successful reaction. When a person gets a smallpox vaccination, it's read in 6 to 8 days. When a person gets out of boot camp, they get revaccinated. On revaccination, if it takes, it's recorded as major. If it doesn't take, it's repeated one time and one time only at a 10-day interval. And if it still don't take, it's recorded as equivocal. When a person gets a smallpox vaccination, you use the upper deltoid area. You put the drop on the skin. You take the needle. You use the multiple pressure method. It may be termed intradermally. The area should not exceed 1/8 of an inch in any direction. Allow the vaccine to air dry for 3 to 5 minutes without exposure to sunlight. If you expose it to sunlight, you may inactivate the virus. Remember that if the skin is clean, you don't use anything. If the skin is dirty, you would clean it with soap and water. Ain't this fun? You know how I get this ditty? Some guy come back from overseas and went to my classes, and he said, "Man, that ditty really helped me." I said, "What's that?" He said, "That one about nobody cares but they talk to people." I said, "I didn't make that up." Nobody cares but very thoughtful people. N is a nerve agent, also known as an anticholinesterase agent. 2 enzymes in the body required for normal nerve stimulation: acetylcholine and cholinesterase. If a person is exposed to a nerve agent, it is against cholinesterase. It causes an accumulation of acetylcholine, and if you don't have equal amounts in the body, the person would be overstimulated. So a person dies from exposure to a nerve agent, they die from overstimulation. What are you going to give them? Atropine. Remember that the atropine is an acetylcholine blocker. It keeps acetylcholine from being generated until an equal amount of cholinesterase can be regenerated. If a person is exposed to a nerve agent, if it's a vapor, the first symptom is going to be pinpoint pupils, tightness in the chest, muscle jerking and twitching, and salivation. They'll be drooling and slobbering. If they have the liquid on the skin, the first symptom will be muscle jerking and twitching, pinpoint pupils, tightness in the chest, and they'll be drooling and slobbering. What's the max amount of atropine that may be given by non-medical? 6 milligrams or 3 syrettes. What's the max amount that can be given by medical? There ain't no max. They would give atropine every 10 to 15 minutes until what appeared? Mild atropinization. Signs of atropinization are the mouth dries up and the person develops tachycardia. Once the nerve gas cavity has gotten to medical aid, what drug is used as an adjunct to atropine? 2-PAM chloride. Remember, the G agents were discovered by the Germans. GA is taboon. GB, sarin. GD, Solman. And the only nerve agent used by the United States is VX. Next, a blood agent is also known as a systemic poison. A drug agent interferes with oxygen supply to the brain and the vital organs. You need a drug that's used for immediate vasodilation. You need amyl nitrite. You would crush 2 ampules, place under the mask, repeat every few minutes until you use a max of 8 ampules. Remember, the person is either going to die quick or they're going to get well quick. Once the blood gas casualty has gotten to medical aid, the drug that's used as an adjunct to amyl nitrite is sodium thiosulfate IV. The blood agents listed in the book AC is hydrocyanic acid, smells like almonds. CK is cyanogen chloride, no garlic. There ain't no smell. Next, a choking agent is also known as a lung irritant. If a person was exposed to a choking agent or lung irritant and they died, they were referred to as a dry land drowning. What specific treatment? There ain't none. All you can do is treat them symptomatically. Once you give them the medical aid, give them supportive treatment with oxygen, but there is no specific treatment. CG is. Phosgene smells like. Dumode hay. CL is. Chlorine was first used in Ypres, Belgium, WW1, 1915. How many casualties? 5,000. The United States had 1/3 of its casualties during the First World War due to chemical agents. B. A blister agent is also known as a vesicant. HD is. Mustard smells like. Garlic or horseradish. HN is nitrogen mustard. Nitrogen mustard smells like fish. If a person is exposed to mustard or nitrogen mustard, symptoms are delayed in appearing. They don't normally appear for 12 hours, maybe delayed up to 48. Normally the first sign is reddening of the skin. And remember, once redness appears, that decontamination is useless. If the eyes are affected, they would have what feeling in the eyes? A gritty feeling like they got sand in the eyes. Whereas, if they are exposed to the other blister agent, which is lewisite, they're going to have what? Pain on contact. What are you going to give them? BAL, which is British anti-lewisite, which is also known as dimercaprol. Remember, lewisite smells like geraniums. And what would you use in the eyes of the lewisite casualty after 24 hours? 30% sodium sulfacetamide. And the other blister agent that's listed is CX, which is phosgene oxime. If a person is exposed to phosgene oxime, how are you going to treat them? Sodium bicarbonate dressings. Remember that those 4 agents are used primarily to kill. The next 3 are used in training and riot control. A vomiting agent is also known as a sternutator. If a person is exposed to a vomiting agent or a sternutator, how are you going to help get rid of the symptoms? Vigorous work and exercise will help to get rid of the symptoms. And the 3 vomiting agents are DM, which is Adamsite, DA, and DC. Vomiting agents smell like? Burning fireworks. That's right. Are you reading it? See, that she's pumping her chest out because she's smart, see? Burning fireworks. Next. Tear agent, also known as a lacrimator. If a person is exposed to a tear agent or lacrimator, if they have chest discomfort, it can be relieved by talking. If they have the liquid on the mask or on the skin, it can be relieved by facing the wind. You face the wind and it will evaporate it. The 2 tear agents listed in the book, remember that CS is more potent than CN. Next. Psychochemical agent, also known as a hallucinogen, a drug that alters body thought. The standard psychochemical agent used by the United States is BZ, which is also known as 3-quint. What specific treatment? There ain't no specific treatment. All you can do is keep them from hurting themselves or anybody else, put them in a padded cell, put them in a straitjacket. But there's no specific treatment. What drug is used after 4 hours? Physiostigmine is used after 4 hours. You don't throw my stuff all around. It ain't mine anyway. The shock wave accompanying an underwater burst will produce mechanical injuries. What type of burst creates more burn casualties? An air burst and burns of the eyes. A night air burst. What type of clothing gives you the best protection? Loose-fitting, light-colored wool. What type of material is more resistant to nerve agents? Polyester and butyl rubber. Flash blindness results how long after nuclear attack? 20 to 30 minutes. If a person suffering from radiation overdose, they should be placed on antibiotic therapy. What dose? Triple the recommended dose, along with an antifungal antibiotic such as Grispeg, which is griseofulvin. What type of radiation is most penetrating? Gamma rays. What type of radiation does the most damage if it gets into the body? Alpha particles. Remember that alpha particles can be stopped by a piece of paper, but if they get into the body through a cut or through respiration, they do the most damage. What's the most common microscope used in a lab? Compound. What controls the amount of light that reaches the condenser? The iris diaphragm. What's the youngest form of neutrophil? A metamalosate, which is also known as a juvenile. It progresses from there to a band, which is also known as a stab, and it is what shape? As for horseshoe shape 2, segmented 2, hypersegmented. What's another name for neutrophil? A phagocyte. What's the KOH preparation test used for in the lab? For fungi. If you did an RPR test for syphilis, what would indicate non-reactive? A light gray color. If it was reactive, what would you have to run? FTA, AFB. And remember, if they didn't have any of those tests on, what are they looking for? Dark-Field's exam. Mononucleosis. Symptoms are usually demonstrated by the 4th day, but practically always by the 21st day. What's the most important RH factor? Factor D. What percent of the population is RH negative? 15. RH positive is 85%. Remember PMTM. P is psychrophilic, live and reproduce best in 15 to 20 degrees centigrade. Mesophilic, 20 to 45 degrees. Thermophilic, 50 to 55 degrees. And remember, microaerophilic, live and reproduce in reduced amounts of oxygen. What's normal specific gravity? Remember 15 to 30, 1.015 to 1.030. What's the most convenient means for determining specific gravity? The urometer should not touch the sides of the container as read at the bottom of the meniscus. But if they don't have a urometer on there, they have a thing that looks like a telescope. That is an index refractometer. Pale urine with a high specific gravity due to the presence of sugar. If cats are present in large amounts, the urine is always positive for albumin. What test would be used in the lab for determining albumin? The sulfosalicylic acid test. And what would indicate albuminuria? A white turbidity. Cast in urine is indicative of kidney disorder. What must always be reported in a microscopic exam of urine? RBCs, erythrocytes. And what's normal WBC in urine? 0 to 3. Anything more than 3 indicates a urinary tract infection. Where do you make the puncture with a hemolytic on an infant? In the heel or the great toe. Why do you wipe the first drop of blood away? To avoid dilution with tissue fluid. Remember that you don't squeeze it. You squeeze it, you get serum in there, and you won't have an accurate count. When you do a WBC count, the WBC pipette has a white pellet. You would draw the blood up to the 0.5 mark, and then what diluting fluid would you use? Either acetic or hydrochloric acid. You draw it up to the 11 mark. How long do you shake it? 3 minutes, not in the direction of the long axis. You do an RBC count. RBC pipette has a red pellet. You would draw the blood up to the 0.5 mark, and then you would use 0.85% normal saline, which is also known as sodium chloride. You draw it up to the 101 mark. Again, you would shake it for 3 minutes, not in the direction of the long axis. How many fields in a WBC? 4. You multiply by 50. How many fields in an RBC? And you'd multiply by 10,000. The fields has how many squares? 16 squares. How big? 1/25 of a millimeter. And how deep? 1/10 of a millimeter deep. What's the best urine preservative? Toluene is the best. Why? Because it seldom dissolves to produce false positives for albumin. Which one sometimes dissolves to produce false positives? Thymol. Remember that when you use a urine preservative, all you're doing is putting a thin film on top of the urine to keep air from getting to it. And if you're not going to examine urine under the microscope right away, you should keep it in the refrigerator. And when you pipette, you got to pipette below the urine preservative. What's the most common microscope used in the lab? Compound. What controls the amount of light that reaches a condenser? The iris diaphragm. What objective on the microscope would you use for detailed study of stained bacteria? Full immersion, WBC count. Low power, RBC count. High drive. What's the rule for counting cells when you're doing a blood count? You don't count the backward L, you count the cells that touch the lines on the top and the left, but you don't count the ones that touch the lines on the bottom and the right. You don't count the backward L. And if the cells vary by 20 cells from the field containing the fewest to the field containing the most, you have an inaccurate count and you have to do it again. What's normal WBC? 4 to 11,000. What's the term that's used to denote a WBC below 4,000? Leukopenia, a few conditions. Typhoid fever, anaphylactic shock, hepatitis. What's the term that's used to denote a WBC above 11,000? Leukocytosis, a few conditions, appendicitis, pneumonia, meningitis, emotional upset during labor. And what's the term that's used to denote a WBC above 100,000? Leukemia. What's normal RBC in a man? 5.4 million plus or minus 0.8 million. Remember the 8. Bring it down for the woman. 4.8 plus or minus 0.6 million. A newborn is 5.1 plus or minus 0.9 million. Remember the RBC in a woman is lower than it is in a man. How about the hematocrit in a man? 42 to 50%. In a woman, 40 to 48. Remember, hematocrit in a woman, again, is lower than it is in a man. What's normal pH of urine? 4.6 to 8 is the normal pH of urine. You collect a 24-hour urine sample, have the person come out at 8 o'clock in the morning, have them empty their bladder and throw it away. You save it from that time until the following morning at 8 o'clock, have them urinate and save it. Normal range is 800, 2,000 cc's, average 1,500 cc's. Let's take a break. Okay, get out your pharmacy and toxicology. We didn't do terminal digit and family advocacy, right? Okay, we need to do them. We got plenty of time, so don't sweat it. Everybody's got plenty of time except people going up for E4. They ain't got many days left. They only got like 5 class days left. They take the test on the 5th. The people going up for second class take the test on the 10th, and you guys take it on the 12th. Yeah. No, 2 days. 2 days after. Oh yeah, I always have the final review the day before the test. Yeah. But that's something we got to talk about too, because the final review, you know that there's no way in hell that I can cover everything in 2 hours. So can everybody in here get get over here about 9 o'clock? Okay, what we'll do that day is we'll start reviewing at 9 o'clock. Okay, and then we'll go until we're done, and it'll probably take between 4 and 5 hours. And then you go back, you take all your books, and you put them away. Don't go to the exam with your books, because if you don't know it by then you ain't gonna know it. And these people that take books to the exam and look, they got to look in there to get a last minute look. All they're doing is confusing themselves. So don't take stuff there. And one of the guys asked me in here, so I want to make it clear too. They asked me about the military. You guys got to know the military, because I'm not giving you no military. It ain't gonna take me long before I'll be able to, get study guys together for the military, but right now I don't have military questions. And besides, that's only 15 questions on the exam. But you might be like Petty Officer Viator that works there in medical repair. He went to my classes in Pensacola, and he aced the test, and he had 9 superiors and a low. So you can do the same thing. The lows don't mean nothing as long as you got a bunch of questions right. Hello. No, we're going right up to the test. No, you just got to follow along. There'll be a couple reviews. But you got plenty of papers to review right now. Okay, what are you saying? Oh yeah. Oh yeah. The review will strictly be me mouthing. It won't be reading, sitting there reading questions and giving you answers. We'll be done everything when I review. Is that what you're talking about? That will be the day before the test. That's what I'm saying. On that day, we'll start the class about 9 o'clock in the morning, and we'll go until we get done. Okay, pharmacy and toxicology. The response of living tissue to chemical stimulation in the absence of disease, this almost exclusively deals with research and development, would be termed pharmacodynamics. Pharmacotherapeutics is the action of drugs on living tissue in the presence of disease and the treatment of the sick. Physiology is the study of dosage. Pharmacognosy is the recognition, quality, purity, and identification of drugs. Using Clark's rule, what would be the dose for a child who weighs 75 pounds if the adult dose is 100 milligrams? 50 milligrams. Using Young's rule, what would be the dose for an 8-year-old child if the adult dose is 15 cc's? 6. Everybody know Young's and Clark's rule? No. No. Everybody would say yes if everybody said yes. Okay. Clark's rule is weight. Weight of child, which is 75, over average adult weight, which is 150. That tells you that the kid is going to get 1/2 times the adult dose, which is 100 over 1. The kid would get 1/2 of the adult dose, or 50 milligrams. Young's rule, the kid is 8. Eight over 8 plus 12, or 8 over 20, equals 2/5 times the adult dose, The kid would get 6 cc's. This stuff is simple. You can figure it out in your head. If I said that the kid weighed 25 pounds, he would get 1/6 of the adult dose. If I said the kid weighed 30 pounds, he'd get 1/5. If I said he weighed 50 pounds, he'd get 1/3. And if I said he weighed 100 pounds, he would get 2/3 of the adult dose. In Young's rule, if a kid was 3 over 3 plus 12 or 3 over 15 is 1/5. If I said the kid was 4 over 4 plus 12 or 4 over 16 is 1/4. If I said that the kid was 6 over 6 plus 12 or 6 over 18 is 1/3. What's the most correct of the two rules? Clark's rule, weight, is the most correct of the two. And remember that the age must be specified on the prescription if a kid is under 12. How long do you keep prescriptions on file? 2 years, the same as. The water test log. Deceit and affairs reports. Evaluation. Everybody wants to say evaluation. You don't have to worry about evaluations. That's E7 anyway. Which of the factors that influence dosage of drugs is not correct? Caucasians require smaller, not larger doses in blacks. What method of drug administration is given by injection? Parental. And a lot of times they'll ask on exam, what immunization must never be given parentally? You would never give oral polio by injection. When you think sublingual, you think of what drug? Nitroglycerin. You would give 1 every 5 minutes till you used a max of 3. An antacid. What antacid may be used as a laxative? Milk of, or magnesium hydroxide, which is MUM, which is milk of magnesia. Remember that if it's used as an antacid, dosage is 5 to 10 cc's, 4 to 6 times a day. And if it's used as a laxative, dose is 15 to 30 cc's. Know that prolonged use of an antacid may cause kidney stones. Know that if a person has abdominal pain, nausea, or vomiting, you should never use an antacid. Which of the below is not true concerning antacids? Aluminum hydroxyl gel, anthogel, may cause constipation, not diarrhea. What astringents used for poison ivy, swelling and bruises, insect bites, athlete's foot, superficial external otitis, but should not be applied to blistered, raw, or oozing areas of the skin? Calamine lotion. Remember that the first two are the same. Burrow solution is also aluminum acetate topical solution. They're the same thing. Which of the following emollients are used to protect sensitive skin from the sun? Zinc oxide ointment. Know that theobromine oil, cocoa butter, is used primarily in suppository form because it melts at body temperature. What synthetic, non-narcotic derivative of codeine acts as an antitussive, is used to control non-productive coughs by soothing minor throat and bronchial irritation? D is the right answer. What antiseptic is the standard by which all other antiseptics, disinfectants, and germicidal agents are measured in their effectiveness? Phenol, which is also known as carbolic acid. What did I teach you about in first aid? If you have a phenol carbolic acid burn, you would neutralize it with alcohol. Remember also that you would never use phenol to disinfect rubber, cloth, or plastic. What percent is peroxide? 3%. They may ask you what's used to clean along a suture line, peroxide. They may ask you what is used in trench mouth, Benson's infection, peroxide. They may ask you, peroxide is decomposed upon exposure to heat, light, or agitation if you shake it. What bacteriostatic cleaning and neurotoxic agent must not be used on premature infants, denuded skin, burns, or mucous membranes? Glycohex, that's right. What systemic sulfonamide is bacteriostatic, is indicated in the treatment of urinary tract infections and acute otitis media? Sulfasoxazole, which is ganthracin. Which of the below listed conditions is penicillin not effective in its treatment? Typhoid fever. What's the drug of choice in typhoid fever? What is the drug of choice in typhoid fever? Remember that I told you that hospital foreman independent duty should not give penicillin, tetracycline, oxytetracycline, but will not give chloramphenicol chloromycetin because it causes a blood dyscrasia. But they may turn around and ask you, what is the specific drug for typhoid fever or rickettsia disease? And that is chloramphenicol chloromycetin. Which of the below is not true concerning antibiotics? Penicillin G aqueous in doses of 10 million units or higher should be given by IV infusion only. 10, not 5. Know that penicillin G is only given by injection. What drug is administered both orally and parenterally for certain respiratory tract infections, otitis media, certain urinary tract infections, and infections of the skin and skin structures? A is the right answer. Which of the below listed drugs is not used in the treatment of TB? Tetracycline. Remember, another name for tetracycline is acromycin. Remember that if you give somebody tetracycline, you should never administer it with milk. What group of drugs are similar to penicillin in their antibacterial spectra and are often used for patients who are sensitive to penicillin? Microlides is the right answer. Know that if a person is allergic to penicillin, the drug of choice is erythromycin normally. What drug is used in the treatment of polynephritis, colitis, and cystitis but is contradicted where significant renal impairment exists? Nitrofurantoin and microdent. But know that if you use that, you've got to use it for a minimum of 3 days. Microfurantoin or nitrofurantoin. And B is the one I'm talking about, chloramphenicol chloromycetin. That's the antibiotic that causes blood dyscrasia. What fungicide is used to treat Tinea pedis, athlete's feet? Undeslinic acid ointment, which is Desonex. A lot of times on the exam they'll ask you what is undeslinic acid ointment, and the only thing that they want is that it is a fungicide. Which of the below listed drugs is not used in the treatment of Candida infections? Undeslinic acid ointment, Desonex, that's right. What drug is a pediculicide but may also be used in the treatment of scabies? Lendane, which is also known as quell percentage, 1%. What drug is a scabicide and also an antipyretic? Urax, which is also known as crotometin percentage, 10%. If you use Lendane for crab lice, you apply it and you reapply it in 7 days. What's B used for? Trichomonas vaginitis, but is contradicted for somebody who is pregnant. What is used as a drug of choice for the prevention of relapse of malaria, but is contradicted in G6PD deficient personnel may result in hemolytic anemia? Primaquine phosphate. What's the most serious type of malaria? Falciparum. What mosquito transmits malaria? Don't you say Aedes aegypti. Anopheles transmits malaria. What is regarded as a drug of choice for pinworm and roundworm infections? C is the right answer. What did I tell you about Povan? Turns stools bright red. And what is the term that's used to denote the excretion of bright red blood from the rectum? Hematochezia, dark tarry stools. Melena. What cathartic normally taken at bedtime is used as a preparatory agent prior to some surgeries and radiological examination? Dulcolax. Know that the first one, glycerin suppositories, is used primarily in children. And know that magnesium citrate is used by X-ray for special exams. What antidiarrheal is a chemical analog of meperidine hydrochloride and is classified as a Schedule 5 narcotic? Both A and B. Know that kaolin mixture with pectin is kaopectate, and that is used for diarrhea. The dosage is 30 cc's after each bowel movement. What analgesic, antipyretic, and anti-inflammatory is contradicted in peptic ulcer disease? Aspirin, which is the first choice. Remember that acetaminophen, Tylenol, has no anti-inflammatory action. And know that ibuprofen is also known as Motrin. What drug has a high incidence of toxic side effects and is recommended only for patients who do not respond to less toxic drugs? Butazolidine. I know that's used primarily for rheumatoid arthritis. What diuretic is indicated in the treatment of edema associated with congestive heart failure, sclerosis of the liver, renal disease, but it's particularly useful when a greater diuretic potential is desired? Lasix. Know that Diamox is classified as a diuretic, and it is indicated in the treatment of glaucoma to reduce interocular pressure. And when you think about glaucoma, interocular pressure, you think of how many millimeters of mercury? 25. They may also have an exam on, or a question on your exam, and ask you which drug is a diuretic. And the answer they want is water. What drug is indicated for use in hyperkinetic children and children with attention deficit disorders? Ritalin. Remember that phenobarbital is also known as luminol. Remember that pentobarbital is also known as Nembutal. What's the drug of choice in the treatment and management of grand mal epilepsy? Dilantin, which is phenytoid sodium. But you could also use phenobarbital. But why is Dilantin preferred over phenobarbital? Because it has no hypnotic properties. Which of the below is not true concerning morphine? It is not preferred for severe pain with acute alcoholism and convulsive disorders. Remember, the two most important alkaloids of opium are morphine and codeine. Codeine is contradicted in what? Migraine headaches. And what is a specific for migraines? Ergotamine tartrate, which is Capregot. And what is used to keep cluster headaches from becoming vascular headaches? Sansert. What drug is used as an intestinal sedative to control diarrhea? Camphorated opium tincture, which is also known as paregoric. And they may ask you, instead of using intestinal tranquilizer, they may say intestinal sedative. Another question they ask quite frequently, compazine and thorazine. Know that compazine is 5 times more potent and less toxic than thorazine. What drug is indicated for alleviating manifestations of psychosis, tension, agitation, may also be used as an antiemetic? That's thorazine. Know that Haldol is used for schizophrenia. What rapid-acting anti-anxiety and antiemetic with antispasmodic and muscle relaxant is most often used in pre- and post-operative sedation and in conjunction with Demerol to potentiate its effect and reduce nausea? Fisterol. Know that Librium, the third choice, is used for withdrawal symptoms from alcoholism. Know that lithium is used for manic depressive illness. I don't see no lithium on this, but on your other form you will have lithium. It is used for manic depressive illness. What drug is most often used as an adjunct to rest, physical therapy, and other measures for the relief of discomfort associated with acute painful musculoskeletal conditions? Robaxin. What cardiovascular agent is indicated for premature atrial and ventricular contractions and other arrhythmias? Quinidine sulfate. Know that digitoxin acts primarily on the heart muscle. What vasodilator is primarily used for prevention of erection in urological adult male patients following circumcision? Amyl nitrite. Remember, they may ask you what drug is used for immediate vasodilation. Amyl nitrite. They may ask you what drug you would use in a blood gas casualty. Amyl nitrite. What vasoconstrictor is the drug of choice in anaphylaxis and also used for the temporary relief from bronchial asthma attacks? Epinephrine, which is also known as adrenaline, which is also known as Susprin. Remember that epinephrine appears naturally in the medulla of the adrenal gland. If you have lidocaine with epinephrine in dental, what's the max dose? The max dose in dental, 300 milligrams. Remember the fourth choice there. Know that tetrahydrozoline hydrochloride is Thiazine. That is used for the eyes. Remember that the anesthetic for the eye is proparacaine, opthane. What anticoagulant interferes with prothrombin formation in the liver, but is extensively used in the treatment of embolism and the prevention of occlusions? Warfarin sodium. When you think of warfarin, you should also think of what? That is the best rodenticide for use by a hospital corpsman. What rodenticide would you use outdoors to destroy rodents in their burrows? Calcium cyanide. When you think of calcium cyanide, you think of what smell? Almonds, that's right. And what rodenticide requires BMIT approval? 1080, which is sodium monofluoroacetate. And the reason you need BMIT approval is because there is no known antidote. What's another name for vitamin A? Retinol is vitamin A. What vitamin is a coenzyme in the metabolism of protein, fat, and carbohydrate is the most often used during inhalation or INH therapy to prevent the development of peripheral neuritis? Vitamin B6. Remember your vitamins. You very seldom ever see an exam they don't have vitamins on it. Remember, A is also known as retinol. When you think of A, think of vision, think of night blindness, think of skin conditions. B1 is thiamine, used to prevent and treat beriberi. B2 is riboflavin, used to prevent and treat pellagra. B6 is pyridoxine, which is used in combination with INH for peripheral neuritis. B12 is cyanocobalamin, is used in the Schilling test for pernicious anemia. Vitamin C is ascorbic acid, used to prevent and treat scurvy. Vitamin D, sunshine vitamin, used to prevent and treat rickets. And vitamin K, also known as menadione, used for various blood disorders. Remember, if that person accidentally took warfarin, you would give them whole blood and vitamin K. What's a good rat bait? Peanut butter, bacon, rind, coconut. What's not a good rat bait? Cheese. What's the outside diameter records? 36-inch outside diameter. A ship in a foreign port to have a deratization exemption issued every 6 months. Who is responsible for an effective rodent control program? The commanding officer. And remember, a lot of times all they want is sanitation. All you gotta do is clean the area up where you don't have bugs, you don't have rats. What rodent likes meat and fish? Norway rat, also known as the brown rat. What rodent likes fruits and vegetables? The black roof rat. What is the most common indoor species of roach? A German roach gains access to a ship more readily through? Not everything. Dry goods, bagged potatoes and onions, food cases, and bottle packages. And they can put some things on that test and make you think. What's the average lifespan of a roach? Till you can stamp on it. Speaking of stamping, did you hear the one about the mama tomato and the papa tomato and the baby tomato was walking down the street and the baby kept falling back? The papa kept yelling, "Come on, come on." The mama kept yelling, "Come on, come on," kept getting farther and farther back. Father went back, looked at him, went, "Catch up." See, you thought that was going to be bad, didn't you? You know how to make a Kleenex, or not? You know how to make a Kleenex dance? Put a little boogie in it. What general anesthetic is commonly used in dentistry or as a pre-induction agent to other general anesthetics? Nitrous oxide, which is laughing gas. They may ask you what general anesthetic is not flammable. That is halothane fluothane is not flammable. What local anesthetic is the standard to which other local anesthetics are compared? Lidocaine, hydrochloride, xylocaine. Remember, the fourth choice there, proparacaine opthane, is the anesthetic for the eye. What parasympathetic drug is indicated for the symptomatic control of myasthenia gravis? A is the right answer, prostigmine. Each parasympathetic drug, anticholinergic, relaxes the muscles of the intestinal tract, bronchi, ureter, biliary ducts, gallbladder, and also inhibits granular secretions, causing dryness of the nose, throat, bronchi, mouth, and skin. Remember that you think nerve gas poisoning. Remember that the atropine causes the mouth to dry up. Person develop tachycardia. Remember that if a person is getting an anesthetic, a lot of times they give atropine with morphine to decrease the respiratory depressant effects of the morphine. This guy was driving down the road. There's little kids in the back seat. And the kid is about 7, and he's reading a book. And he yells, "Daddy, Daddy, bow wow, bow wow." His daddy turned around and he said, "Son, you're getting old enough that you don't need to be talking all that baby talk all the time." He said, "That is a dog. That's not a bow wow." Kid slid down the seat and he said, "Yes, Dad." To go down the road a little bit further, and he says, "Daddy, Daddy, moo moo, moo moo." Daddy said, "Son, now I told you, now you're getting old enough we don't need to be talking all that baby talk." He said, "That is a cow." And he said, "A dog is a dog, it's not a bow wow." Slid down the seat, he said, "Yes, Dad." So he got to going down the road a little bit farther, and he thought, "Man, this is really bad." He said, I really shouldn't do that to my little kid, So he turned around and he said, "Hey, son," he said, "what you reading?" He said, "Winnie the Shit." What drug is used in the treatment? Where am I? Hell am I? Oh. What drug is used in the treatment of peptic ulcer by reducing the volume of the acidity and gastric secretions, and as an antispasmodic in the treatment of intestinal spasms and in spasms of the ureter and bladder? Propanethine bromide, which is probanthine. What sympathoplegic drug is used in the prevention and treatment of postpartum and post-abortive hemorrhage? Ergotrate. What antihistamine has a long duration of action than Benadryl and is used for relief of motion sickness but is contradicted in pregnancy? Meclizine. Know that Dramamine is used to prevent and treat motion sickness but may be used to control nausea and vomiting with radiation sickness. Know that Benadryl is used primarily for allergic reaction. And the side effects of an antihistamine is drowsiness. Remember, anybody that gets an antihistamine, there should be a warning label on there saying that it may cause drowsiness. Another question that we haven't covered that has been on a lot of tests is, before you issue a drug, you should read the prescription how many times? 3 times. What drug is indicated for the symptomatic relief of nasal congestion due to common cold, hay fever, and other upper respiratory allergies? Sudafed is the right answer. Remember that Tagamet and Zantac is used for ulcers. What food poisoning is due to a specific toxin produced outside the body? Food intoxication. Remember, 2 types of food poisoning: food infection and food intoxication. Food most commonly involved with food intoxication are pork, ham, and salami. Food infection is poultry, especially turkey. And remember, botulism has a 60% mortality rate, the same as aspiration pneumonia. Botulism is caused by home canned acid foods such as green beans or corn. Who establishes a clearinghouse for poison information? The Public Health Service. What are the four emetics in the antidote locker? Ipecac, soap, salt, and mustard. What is activated charcoal? That's an absorbent. It's not an emetic. What type of poisons are subdivided into corrosives and metals and earth salts? Inorganic. Remember what I told you in first aid. If a person accidentally took turpentine, you would give them vegetable oil orally. Was it turpentine? I think it was. Yeah, first aid. If it ain't, somebody check it. What act of 1970 was established to define 5 schedules for drugs dependent upon a drug's potential for abuse, medical usefulness, and degree of dependency if abused? The Comprehensive Drug Abuse Prevention and Control Act of 1970. What schedule of controlled drugs may have prescriptions refilled up to 5 times within 6 months? Schedule 3 and 4, both of them. 5 schedules of drugs. Schedule 1 has no accepted medical usefulness and has a maximum abuse potential. Schedule 2 has accepted medical usefulness and has a high abuse potential. Drugs such as morphine, Demerol, the amphetamines, and pentobarbital. Remember, the Schedule 1 drugs are heroin, marijuana, and LSD. No accepted medical usefulness. What's a street name for the amphetamines? Bennies and turn flips. Cartwheels. Which of below is not a true statement concerning the antidote locker? That's right. Remember, the antidote locker will be secure with a wire seal. Anytime a seal is broken, you got to do an inventory. If it's not broken, you don't have to do an inventory. It will contain the minimum antidotes that's listed in the NADMED P5095, which is poisons, overdoses, and antidotes. It will have a list by shelf of all the antidotes that you have in the locker. There will also be the address and telephone number of the local poison control center. And what is the book, in addition to the NADMED P5095, that's in the antidote locker? The Handbook of Poisons. And the book that's hanging outside the locker is Clinical Toxicology of Commercial Products. Remember, the antidote locker on a large ship is located in the emergency treatment room. On a small ship, it's outside sick bay. What book in the pharmacy is an excellent source book for compounding information that's known as the Pharmacist's Bible? Remington's Pharmaceutical Sciences. Know that the book in the pharmacy that is official legal status is a constant source of reference for the pharmacist is the USP, United States Pharmacopoeia. Know that the Pharmacopoeia and the National Formulary are revised every 5 years. Know that the annual publication that has 5 color-coded sections is the PDR. What system is the one used in the United States for weight only, used for commercial buying and selling? Advertipoi. Remember, the official system of weights and measures used in the Navy is the metric system. What's the smallest unit of volume in the apothecary system? The minim. The smallest in the metric system is the liter. They may ask you, what is the weight of 1 cubic centimeter of distilled water? The answer is 1 gram. That always seemed dumb to me, but there's a hell of a lot of tests that question was on. What's the primary unit of weight in the advertipoi and the apothecary system? The grain. What's the household equivalent of 15 cc's? 1 tablespoonful. What's household equivalent of 120 cc's? A teacup. Everything on it, I doubt that they get that nitpicky with you guys, but they normally have it on the third and second class exam. But remember that everything is doubled. 1 teaspoon is 5. A dessert spoon is 10. A tablespoon is 15. 2 tablespoons is 30. A wine glass is 60. A teacup is 120. A tumbler is 240. A pint is 480. And a quart is 960. What's the apothecary equivalent of 240 cc's? 8 fluid ounces, which is a tumbler full. What's the process of converting a solid into a liquid by means of heat? Fusion. They may ask you what's the process of placing a substance in a mortar and applying the pestle in a rotary motion. That is called trituration. What would 86 degrees Fahrenheit equal in centigrade degrees? 30 degrees. What would 70 degrees centigrade equal in Fahrenheit degrees? 158. Remember that 10 degrees centigrade equals 50 degrees Fahrenheit. And a lot of times if they ask you Fahrenheit, centigrade, centigrade to Fahrenheit, by knowing that 10 equals 50, you're going to be able to eliminate either 2 choices or all 3 of them. 2 numbers you got to remember. You either add or subtract 32, and you either multiply or divide by 1.8. So you know centigrade is smaller than Fahrenheit. You would multiply and add. So if you go from centigrade to Fahrenheit, you take degrees centigrade, you multiply by 1.8, and you add 32. So if you go from Fahrenheit to centigrade, you subtract 32 and you divide by 1.8. Like I said, if you know how to convert, don't let me screw you up. You do it your way. Don't think that this is the only way. There's a lot of other ways to figure Fahrenheit to centigrade, centigrade to Fahrenheit. So if you know how to do it, you do it your way. Don't do it this way, but this is an easy way to remember it. The mortar and pestle used for triturating very pure products such as eye ointments or preparations which stain should be made of glass. What type of balance is optional equipment in the pharmacy used to weigh loads of more than 648 milligrams must be conspicuously marked Class B? I've never seen them get that nitpicky where they're going to ask you how many milligrams that you would weigh it. But know that every operational pharmacy in the Navy will have an A balance. B is optional. The 2 types of A balances are the equal arm balance and the torsion balance. Alcoholic solutions of vegetable drugs of such strength that 1 cc of the solution contains the active ingredient of 1 gram of the crude drug are called fluid extracts. Which of the following medications don't require shake well label? liniments. What size capsule has a capacity of holding about 65 milligrams of a substance? 5. Again, I've never seen him get that nitpicky about milligrams, but know that in the Navy, the largest capsule is 00, and the smallest is 3. In the civilian world, the largest capsule is 000, and the smallest is 5. What type of drug incompatibility exists when sulfa drugs are inactivated by procaine? Therapeutic. To counteract the effects of barbiturates, physiologic antidotes may be given, including ephedrine. And remember, if a person dies from an overdose of barbiturates, they would die from respiratory failure. Drugs which stop the growth of microorganisms without necessarily destroying them are known as antiseptics. Remember that sides kill. Antiseptics just stop the growth. See you tomorrow.